So diabetic retinopathy is a condition that affects the retina, again, the nerve tissue in the back of the eye. It actually specifically targets the blood vessels that nourish the retina. In very early stages of the disease process, we see these very small little hemorrhages in the retina. These hemorrhages are so microscopic and small that most patients don't notice them at all. Which is, again, why it's important to have a screening eye exam at least once a year for diabetes. And when we get into talking about diabetic retinopathy, it's important to remember, too, that this is the most common cause of vision loss in people under the age of 65 in the country. So it's very important that patients are screened and treated early because we know with earlier intervention, patients are more likely to do better. Now, with diabetic retinopathy, what we start to see happening as these hemorrhages become more frequent, we know that the level of severity is getting worse. Again, a lot of times these patients don't have any symptoms, and it's always best to treat these things sooner rather than later. So that's one form of retinopathy we call background retinopathy. And again, most cases of background retinopathy don't have any symptoms. What can happen in more advanced stages of the disease is patients can actually start to grow blood vessels into their retina. This is what we call proliferative diabetic retinopathy. This is, again, a much more severe form of retinopathy and a potential source of blindness. These blood vessels can leak and cause bleeding in the eye. They can also scar down and cause what we call contractional detachment of the retina. So again, getting at these blood vessels earlier will help oftentimes stabilize and prevent further vision loss. We really, aim treatment sort of in two broad categories. Patients with diabetic retinopathy in both the background form and the proliferative form of retinopathy can develop what we call macular edema. What can happen with these blood vessels in diabetes is they can start to leak very easily and cause fluid accumulation. Macular edema can be treated in a couple of different ways. What we like to do with patients is bring them in for some testing, a dye test called a fluorescein angiogram, where we actually inject some dye in their arm, take some pictures of the back of the eye. What these pictures show us potentially is some leakage points of these blood vessels here, and in some cases you can actually laser these leakage points. That's a very effective method. It was the treatment we probably used for over 30 years. More recently, we've got the technology now of injections of medicine into the eye, and these injections are also very effective at getting rid of the fluid and preventing further vision loss. Injections oftentimes have to be repeated, so that's something to keep in mind when you're going through therapy. The upside with injections, of course, though, is that there's with laser, there's a potential for causing injury if you get too close to the center of vision, where injections, if you've got fluid near the center of vision or in the center of vision, they're much safer in terms of preventing any or causing any damage. As far as the other treatments that we use in diabetic retinopathy, the proliferative form of diabetic retinopathy typically will treat with a laser procedure. As I mentioned, these blood vessels that are growing in the retina can cause damage, and we want to cause these blood vessels to shrink rather quickly. So what we offer is a laser treatment to cause these blood vessels to shrink, and sometimes even supplement that with injections of medicine as well. In more advanced forms of the disease, surgery can be offered.